How do I know I should do ketamine?
Whew.
Simple answer.
How do you know you should do ketamine? Well, first and foremost, there's typically a reason that someone's seeking out therapy, whether it's an issue with a spouse or a partner or kids or something is getting in the way of progressing towards a goal that they might have. That's generally the reason anyone goes to therapy to start with. And so that's a good place to kind of configure, well, do I need something that's more intensive than general therapy? Do I need something that actually helps dissolve the ego to get out of my own way and kind of go from there? So really it takes two to tango in that circumstance to really kind of figure out how involved and how invasive does the therapy need to be.
Is ketamine addictive?
Is ketamine addictive? So on paper, no. So if you look at the classic tests of addiction where, basically you set up mice to pull levers with preference and sucrose condition preferences, all those studies pretty much indicate that there's no real addictive capacity as far as you take the agent out, someone has withdrawal and craving and physiologic symptoms of addiction. That being said, it is quite physiologically escaping, and it does offer a sense of euphoria and disconnection with any problems you might be having. And so if it's used outside of the context of therapy in a real relationship built around fixing a deep kind of emotional or affective issue, it can definitely be used somewhat of an alcohol replacement to where people could get addicted is not the word in the sense, but definitely dependent on its ability to help them calm down in response to different stressors.
Can anyone who has had addictive tendencies in the past, like alcohol addiction or drug addiction, go into ketamine therapy safely?
In the context of therapy, yes. So it's actually being studied in the context of addiction to help people kind of get through the underlying disturbances that lead someone to kind of need a substance to give them either a sense of calm or, correcting a different other motivational state. That being said, again, you really have to do a good job screening for someone who's really wanting to correct an issue rather than displace what they're using currently for something else that's kind of more either accessible or socially acceptable.
Should I date someone who's doing ketamine therapy?
Probably not. So given that most people that pursue ketamine therapy or psychedelic therapy of any sense is really to kind of uproot some of the behaviors and motivational states that have gotten them to a certain place, I would argue that if you get into a relationship with someone who's going through that process, if you fell in love with or if you like the attributes of a person prior to them going through a set of ketamine infusions, you might not be falling in the same way for that same person because either they'll know themselves better, they'll put up with less of your shit, or they might just be more awake and more conscious of the decisions they're making and decide that, hey, maybe you were a pattern that I didn't really like to exploit.
This is a second part to that where it's like my husband is doing ketamine therapy treatment. How can I help him through that, and what should I expect?
Okay, so the supportive role of a partner or spouse through ketamine therapy is actually quite important because the fragility and the expanded kind of malleability the mind has and the neuroplasticity that someone has after ketamine is very potent in how they can change their mindset moving forward. So if someone's going through therapy and they go home and they have a very chaotic environment that really challenges all the things that we've kind of gone through in their therapy session, then it's kind of too much too fast. Now on the flip side, I kind of tell my clients that have a supportive partner not to dig in too much to the actual session, but to allow the individual to journal, to get their thoughts on paper, to really express thinking through a different avenue than communication with someone who might trigger them into otherwise receding into a pattern that they kind of were trying to get out of in the first place.
Can or should children with trauma do ketamine treatment?
Children, I would say it's definitely age dependent. I've had a few minors, with the permission of the parents, of course, do ketamine. All of them have thrown up, so they seem to have a higher proclivity for the gastrointestinal upset that ketamine can cause. But that being said, there definitely is a place for it, especially since childhood trauma is one of the main indications for a psychedelic to be used to kind of access those non-declarative memory systems. So it's definitely case dependent, and the parents have to be on board. The child, of course, kind of has to be on board. The other problem is that usually kids don't really know how to access those deeper states and those deeper emotions and kind of how to contextualize it. So having a professional guide them through that process can be super helpful. But I would almost say that it would be better to have a typical therapeutic context before going into using a dissociative or a psychedelic.
Can pregnant women do ketamine therapy safely?
On first principles, I would say no. I'm not aware of any studies that kind of actually look at the placental transmission of ketamine, through the placenta, as far as disrupting neuronal development or embryonic development, but just in terms of it being a sympathomimetic and increasing blood pressure and, risking preeclampsia and all these different things that go along with pregnancy, it wouldn't be a good time to do it.
Will ketamine therapy help my PTSD?
I think that really depends on the amount of work that you've done leading up to using ketamine as a therapeutic. I think it also really depends on who's taking you through the actual therapy itself. In my practice, it's been pretty transformative for people with PTSD, but it's also a very different modality in how we address the actual incidents, because at least in terms of adult onset PTSD from something that happened in the time frame of declarative memory, they have an actual trauma, they have the experience, they have the emotion to kind of work through. It works very quickly in that sense because we have a real target to go back into. In terms of childhood trauma that might be leading to kind of adult onset PTSD later in life, it really takes an astute provider to go back and look at how to dive into where patterns and behaviors have manifested in the here and now from way back when. It's not about isolating the actual trauma or even giving that event more credit or validity. It's about, you believe something happened or something happened. It might be kind of fuzzy, but the whole point is that something that happened in that space led to coping strategies or defense mechanisms that need to be torn away in light of being an older adult that has the capacity to take those issues on and also adapt in their presence and make it more of a post-traumatic growth rather than a post-traumatic stress.
Can I do ketamine if I smoke weed?
So it depends on why someone's smoking weed. If it's a tool that they're using to cope with stress, or if it's a tool that they're using for whatever reason they don't know why, it's just kind of something they do. It's similar to when people just drink alcohol for no reason except to cap off the end of the night. There might be something more to their reasoning behind using a dissociative drug like THC, but in and of itself, it's not contraindicated for someone to be smoking marijuana or consuming THC in any capacity and do ketamine at the same time.
What are things I should look for in a provider that is offering me ketamine treatment? What should I avoid?
It really behooves the individual that's going for the therapy to really understand who's doing the therapy for them, what kind of philosophical background they use to kind of explain not only the neurodynamics of what ketamine is doing, but the actual phenomenology and existential implications for how ketamine actually dissociates the ego and allows someone to dive into a very deep level of their selves. Typically, individuals who administer ketamine in the clinical setting don't really have a program that's involved with actual administering therapy in the session. There's kind of this ethical dilemma of using talk therapy in a dissociative state because it can be kind of seen as manipulation or using a drug to kind of dive into the psyche without someone's really explicit consent. But that being said, as long as you kind of explain what you're trying to do and how it's working for the individual to actually get through their issues and their complaints, it's a very effective tool. So again, it kind of boils back down to why is someone reaching out for ketamine, how in-depth of a intervention it's going to be, if it's for pain, if it's for depression, if it's for suicidality, if it's for PTSD. They all kind of have a different therapeutic aim, and I think the administration has to accommodate for those different kinds of conditions.
I'm starting ketamine treatment. Is there something I could do to help the treatment and the process overall before starting?
Yes. So I have everyone do pre-work, right? So everyone has homework to do before we actually do our first session. And that actually utilizes Dr. Jordan Peterson's past authoring exercise where they kind of go through their entire past, they lay it out in a very subsequent manner. And that way, not only do they get more in touch with their past and how they got to a certain place currently, it also provides therapy in and of itself. So they actually get a preconditioned mindset of, oh, I haven't thought about these things in so long, but it turns out that some of these events or time frames have a lot of affective meaning for me that I didn't really consider. And so when it helps the provider get on the same page with them, it actually facilitates the movement forward. It consolidates the amount of time we have to spend updating each other on, where we are. And so that's a preconditioned necessity to starting therapy, at least in my clinic.
What is the difference between ketamine therapy and ketamine-assisted psychotherapy?
So classically, when the first 6 infusion set for depression kind of came out, it was you set someone up at a certain dose and you give them 40 minutes to kind of dissociate and have a mystical experience on their own. They didn't really tie together the necessity for mystical experience and getting better. I think that's still under pretty high debate. That being said, that model has kind of evolved from just letting someone sit back with eye blinders and some music in the background to facilitating a movement volitionally through talk therapy towards a place where they want to be and actively working through those neural mechanisms to call forth a behavior, motivation, or desired state, and actually working through events and traumas and doing the whole inner child work and these different mechanisms that we can use as therapists to bring someone across a bridge to the other side of where they ultimately want to be.
Is there a major difference between ketamine and psilocybin or other classical psychedelics?
Yeah, so ketamine is kind of in its own classification as a dissociative anesthetic, up there with like xenon gas and nitric oxide or laughing gas. So the way that it kind of classically works, neurochemically speaking, is as an NMDA antagonist. So that's the major excitatory glutamatergic transmitter in the brain. It does a whole lot more, so it's kind of simplistic to think of it as a pure NMDA antagonist, especially because at certain concentrations it will excite those downstream disinhibited GABAergic neurons. So the neural dynamics are quite complex. But all that to say, the difference between classic psychedelics that hit the serotonergic side of the neurotransmitter system versus ketamine, which hits more of the NMDA and the glutamatergic side, that's where you get most of the actual difference between a hallucinogen that gives you altered sensorium in the actual external world versus an internal dissociative anesthetic that gives you more of an internal disrepresentation of, or an internal representation of altered states of consciousness.